Well, hello and welcome to Blueprints Behind Business. I'm your host, Brad Douglas, and today I'm joined by Dr. Aneel Paulus with West Eastern Health. Dr. Paulus, thank you so much for joining us.
Hey, thanks for having me, Brad.
Great. So before we get too far into any kind of questions here, I'd love to learn more about you, a little bit about your background, and maybe a touch on West Eastern Health.
Sure. So I'm a physician scientist. That means that I have an MD, but I also practice laboratory-based medicine and had a laboratory program at the Mayo Clinic for many years here in Jacksonville, Florida, focused on oncology drug development and mainly translating uh, discoveries that we had made in the laboratory based off of understanding how cancer cells work and what drives cancer, and then what are the best new treatments that we can come up with, and then taking that into a clinical format where we can test these new therapies. So that was my background. And eventually that led me to understand that it's not just the lifespan, of patients that we want to extend, but also the quality of their life and overall health, which includes their mental health. And so that's really where West Eastern was born, to be able to take on some of these challenges that I felt were not being addressed in many areas, in many institutions, um, and being able to utilize some very unique, alternative, kind of cutting edge treatments that are interdisciplinary, holistic, and be able to offer a kind of a full program, again, to improve not just the survival of these patients, but the mental health that they have as well.
Fantastic. Really interesting background and where you've gotten to today. It kind of leads us into, if you don't mind, we'll jump into the first question with your extensive background in healthcare. You've spanned various specialties and leadership roles. What inspired you if you can expand on, what inspired you to launch West Eastern Health? And the second part of the question is, what was maybe a defining moment or experience that led you to establish, your own healthcare focused business?
So I trained originally as a clinician, and then subsequently really found my calling to be in the laboratory. Um, Always kind of looking at what could be, right? Not what is necessarily, but how can we make things better? How can we improve? How do we understand the what it was I was seeing clinically? There was a lot of questions that just couldn't be answered, and so I had a wonderful mentor that said, "Hey, you asked too many questions, and you know what? I'm going to put you in the lab and just go bother people there, and maybe you'll come up with an answer, right? And when you come up with an answer, share it with me." So that's always been my mindset, is that I'm always kind of looking outside the box and seeing exactly, well, if this works, why not this? Why not that? And how do we combine things? So I would say it was a curiosity that really has always inspired me to move forward in anything I've done, starting either with medicine and then laboratory-based medicine. And then finally, it was the desire to really take some of these discoveries that I had made along with other colleagues and be able to actually now bring this to patients. And that's a very different track altogether. It's a different skill set, different language, different understanding, where now you've transitioned something from a discovery phase where you've nurtured it a little bit, and a lot of times many people within the academic setting don't know when to let go, right? You got to take your baby now and kind of have it starting to walk a little bit, and have it crawl and walk and then eventually run. And to do that, I learned that I had to set up a commercial venture, um, which is what led to my first oncology venture. And what I learned a lot from that, essentially, is that, hey, certain things that I thought you could do in one aspect of practice, let's say in clinical or academic medicine, it's a slightly different beast altogether when you start kind of bringing in a corporate mindset, and now it's a for-profit entity with investors and so on. And that's really where I think the inspiration had been slowly kind of percolating, that I wanted to be able to not just develop medicines for cancer patients to combat their cancer, but really now it kind of came full and center that, hey, if we're taking on cancer, which is historically been a an unbeatable beast in many ways. And 1 in 2 people, unfortunately, are going to be touched by cancer in their lifetime. That's the statistics. How do you actually look at this from a completely different mindset, which is that if we're going after cancer, I'm going after cure, and cure to me is prevention. And prevention really, a lot of times, does start in the mind, and the mindset, having hope, having the ability to adopt new habits, new practices, new lifestyle altogether. So that really was the genesis of, hey, can we take things that we know that work really well in Western medicine, and then really kind of take a step back and understand that there's a lot of ancient truths, ancient wisdoms, particularly from the East, where I'm from, and many other cultures, South America, and so forth, that have these practices of different medicines, different ways that they are able to bring in the quote unquote holistic side of care and healing. And how do you marry these two, where now there's harmony between both, kind of Eastern medicine, Western medicine, or holistic medicine, and more, what we practice here within the West. And so that's really where West Eastern was born.
Fantastic. Yeah, I love the fact that there's potentially other options there besides just medicine all the time. So great to hear the background there and how you got started. So, you know, with that, having this new venture, are there any common misconceptions about running a business in the healthcare sector, and how do you address or overcome those challenges?
Yeah, I think that there's 2 perspectives I can give you. One is the perspective of a healthcare practitioner, an MD, or PhD, or somebody who has not necessarily trained as a administrator or a businessman, right? I mean, it's you've come. I came into this with just the sole purpose of trying to help people, with a disease, and eventually, with cancer. So you have this mindset that there's always this kind of altruistic, always this kind of mentality shared amongst everybody, right? That, oh, we're just doing this to help people, and most individuals don't understand the business aspect really of it, right? That there is, you have to provide care, you have to be able to be profitable, you have to be really judicious in the way you allocate time, resources, staff. There's a lot of management, that's required between different levels of providers, between physicians and nurses and medical techs. So I think that's the one thing that most physicians or other healthcare professionals that are training in residency and still kind of learning, getting their bearings straight, really, in terms of what they want to do in terms of a practice, so to say, don't really fully understand. And the same thing goes for academia, where you're very much insulated from the business aspects unless you're really in, you're the chair of a department or you're on the executive operations team. These are not things you get exposed to. It's really only when you open up your own doors, hang your own shingle, that you're like, oh, wait a second. Now I need a practice manager. Oh, wait, now I need somebody for billing. Now I need somebody for, staffing. Now I need somebody for marketing. Now I need, to onboard these nurses or other staff that you have, and they're all looking at you, whereas a lot of times you were looking at a particular, hospital administration, so to say. um, I think that's one common misconception. Another one, what I would say, is from the administrator side, is that administrators only tend to look at the business of healthcare as a business, and it is not like any other business. It is a very, very sacred relationship between a physician and, the patient. And so there's a sanctity there. There's a kind of relationship and trust that's formed, and that trust takes time. That trust takes an approach, really, that you can't be looking at numbers all the time, or looking at little metrics and KPIs, and that's not something that you really want to be doing all the time, especially when sitting with an individual who has now gotten a diagnosis of cancer, and they're not sure what to do next. So I think that's what I would say, is that there are misconceptions about the business side of things and then the non-business side of things, and a whole kind of perspective is needed, where I would encourage an administrator to really spend a few days shadowing a physician, understand how they operate, how they speak, their bedside manners, what information they share, how much time they spend. And similarly, I would say that anybody looking to set up their own practice, clinical or elsewise, um, really understand what goes into owning and operating your own practice. It's a lot of work, it's a lot of patience, a lot of time, and you really need a fantastic practice manager. So that's what I could say about that. There's a third dimension I could go into, which is a biotech, which is something that I also oversee. We're developing a couple different assets. One's in clinical stage, the other's in preclinical stage. And that's again, at a very different level now where you're responsible for understanding how exactly you're going to get that drug from a laboratory phase into, a package that you can submit to the FDA, interacting with the FDA, forging relationships as to, okay, how is this going to get tested, when you have to go into clinical trials. And then after that, really got to figure out the game plan towards the end. Where do you want this drug to land? Do you want it to land in a particular patient population that's seen one therapy, two therapy, three therapy? If so, what are those therapies, right? And so there's many, many different dimensions that one has to think when really setting up a business or going down the route of an entrepreneur out of a purely medical, whether private or academic practice.
Great points. Great points. And I can understand coming from, having all those resources around you to now you having to be the resource for many of those, but really great points. So when we think about healthcare, reflecting on your journey in healthcare, is there a specific lesson or piece of advice you wish you had known early when you first started?
I think that for me personally, uh, I would go back and tell my younger self, hey, maybe learn a little bit more about finance, maybe learn a little bit more about management, maybe learn a little bit more about product design. Maybe just use these other perspectives, right? These are all different perspectives, in my opinion, with a different language that then gets added on. So shift your narrative, shift your perspective, be open a little bit more to these different perspectives, and you may end up, achieving maybe a little bit faster than just kind of trial and error, which is the route that I end up kind of going through. Is I just trial and error different things and landed where I am today. But I've had to learn the language of finance, accounting, business management, operations, um, and I think I would have probably done a little bit more of that, back then.
Well, earlier on, that makes complete sense there.
And find a great mentor. I got lucky
Yeah.
with mine, but many people I've realized try and do this all on their own, and not something that I wish I would have done, but something I would encourage people to do because I was really fortunate to have good mentorship as I went down this path.
A good point. It's always good to have, help in some kind of way there through mentorship. It was huge for me in my career for sure. Um, so healthcare is obviously an ever evolving industry. How do you stay adaptable and innovative in the face of constant change? And kind of a two-piece of this is, are there any specific or particular strategies or approaches you use to keep West Eastern health at the forefront of the field?
Number one, I would say that change is the only thing constant in life, right? We're always changing. The world's always changing, and we're changing and evolving at a pace that is just staggering compared to, I would say, 100 years ago or maybe 500 years ago. So being flexible within your mindset, being flexible within your body are the two things that I have found have helped me keep up with this change, be open to new ideas. There's a great quote that, and I don't mean to get too philosophical, but I love philosophy. I love, you know, the Stoics. I love, a lot of different things that you can look at from the past to today. And F. Scott Fitzgerald was known for making this quote that the mark of first-rate intelligence is being able to hold two opposing views simultaneously and forming a cohesive narrative out of that. And I've kind of adapted that in my life. I'm very much into different technologies, AI. I've been using AI and machine learning in drug development for the last decade. And quantum computing, is something that now is kind of a buzzword, but really all quantum computing really relies on is the ability for an electron to sit in two different states at the same time. Or in binary, it can be a 0 and a 1. not either or, which is just traditional computing. It's called a superposition. So one of the things that I would encourage people to do is think in terms of superpositions. Be curious and be open to having two opposing views, even if you don't necessarily agree with one, or you agree more with one now. Be open to the fact that you could see where this opposing view could lead to a different future, a different, better alternative down the road. So that's one thing I'd say. The other thing I would say is flexibility of body. I really have taken the last few years and I've lost a ton of weight. Really have gotten myself into shape by eating healthy, sleeping appropriately. I still need to work on that. My Whoop kind of keeps me in track over here. Really cutting down on unhealthy foods, ultra processed foods, cutting out alcohol almost entirely, and finding different ways to kind of supplement your diet. There's a few key supplements that I take that I think are game changers for me. And overall, to answer your question, I think that really has helped me remain much more flexible and nimble, be able to kind of absorb new information and figure out exactly how I'm going to be able to work around it, and be constantly able to pivot and shift from a business standpoint, right? And that's the same thing I would say with West Eastern, is that we're really doing some really cutting edge things here that have been more relegated towards the research realm, but are slowly making their way into the real world. And I'd love for anyone to, interested to get in touch with us. These are things that maybe, are more in the realms, have been traditionally in the realms of the Jeff Bezos or the Elon Musks of the world. But yeah, we're starting to offer some of these things here within the framework of integrative medicine and mental health. So yeah.
Fantastic. So as you continue to build on your healthcare experience, could you share your vision for the future of West Eastern Health, and what are some goals for the next chapter in your journey that you could share?
Sure. The goals are really simple. Is our mission really is to be able to empower individuals, and I use the word individuals rather than patient very strategically. I don't like that term to be used unnecessarily, right? So the goal is really to empower individuals to have agency over their own mental health, right? Many individuals, people feel, they're just stuck, they're trapped, they can't do anything. They have this script running in their head all the time that I'm not good enough, I'm not worth it, I'm a burden, I have cancer, did I do this to myself, who's gonna love me? Or if you're a vet, like you're really, I mean, struggling with some deep dark things, and most of these guys, as you know, Brad, you're trained to just suck it up, don't talk about it. And unfortunately, the body is not designed that way. The body keeps the score, which is also a great book, by the way, by a fantastic physician. I'd recommend that to your viewers. And what that means is that there's trauma that we incur during our lives, and it's not, the goal is not to not have trauma. I think everybody incurs trauma in life at some point or another. The goal is to be able to, how do you process that? How do you process that in a healthy way? So that's one of the things that our mission at West Eastern is really to help individuals who have suffered these tragedies in life, unfortunate, horrible things sometimes, is to be able to help them move through and realign them, reorient their mental health now where they feel like they have some sense of control, and they have some ability to now either talk about it or share it and be a part of a community again. A lot of people, with mental health isolate themselves, and they kind of go into isolation because they don't know what to say, they're afraid, they're anxious, and that drives the whole problem further. So that's really where I see at a high level what we're doing. To kind of get into the weeds a little bit, there's a lot of cutting edge treatments that we're utilizing, including some psychedelic-assisted therapies that are really coming out, and a lot of good data that I can say that I'm seeing, early data for their use in PTSD and treatment-resistant depression, generalized anxiety disorder, and many other conditions. Traumatic brain injury, that's another key area, particularly within the vet community, that they're studying different protocols for these types of therapies. And I think the beauty of them is that I don't personally believe in putting someone on a medicine for the rest of their life if they don't need it, and many people don't need it. So how do you create a therapeutic container that the medicine the pharmacologic agent is a tool, right? It's a tool to achieve a particular goal. And the rest of the therapeutic container is perhaps non-pharmacologic in some way, which again boils down to, for me, fundamentals: sleep, diet, intentional movement or exercise, sense of community. You know, can we start kind of creating the framework around how to get people more involved in thinking about these things, and promoting them, prioritizing them, giving them plans to be able to implement or structure these in their way. And that to me is a much better sustainable pathway towards healing, of any kind.
Well, I can only thank you. I know there's many out there that sometimes are embarrassed or they don't know where to go or they don't know what options there are. So it's glad to know that doctors like yourself and others are creating these environments. So thank you for what you do for sure. So to kind of wrap it up here, for aspiring healthcare entrepreneurs or even just entrepreneurs in general, particularly those starting out or facing industry-specific challenges, um, what's maybe one final piece of advice that you would offer with your background and experience, and lessons that you learned through your career?
If I could dilute it down to three
Okay.
key things, key principles that have really helped me and continue to help me, um, is be humble. There's a lot of success, that people will achieve, and if they're not careful, and they take it for granted, um, that can be taken away from them. So stay humble. That's the first thing, and stay open. Humility is a posture of being open, to receiving information, criticism, um, being challenged. That's what I would say. That's lesson number one that I would really love for people to have. The second kind of follows with that, which is gratitude. Um, Really, we are so blessed in this country, Brad. We really are. And I've lived in many countries, and I've seen exactly, the pros and cons, of living there versus living here, and the freedoms that we have in this country. We enjoy, you know, just by people like you. I mean, to be honest, like, you've devoted a part of your life to serving this country, protecting its interests, and really, I applaud you and I thank you for that. And so, be grateful for your life, for your friends, family, just little things. Sometimes we ignore that. The third thing I would say is be persistent. Never, never, never give up. Never give up. That's the one thing that I would say has carried me through in these three different phases of my life, from um, clinical training as an MD, and then really learning a completely new language and skill set as a lab researcher and drug developer, and transitioning that then to a company to then commercialize oncology drugs, and kind of on the heels of that, now diving into mental health. I'm not a psychiatrist, I'm not a therapist. I've always keenly been interested and learned a lot about neuroscience, philosophy, psychology. Um, over the years, it's something that's just a passion of mine, and so I've taken all of these different skills and things that I've done, and maybe one last thing I'll say is that as we move in this new kind of era of so many different things coming online in education and technology, I do believe people every 5 years or so are going to find themselves reinventing who they are and really learning new skill sets. So always be learning, always be learning new things and learning new ideas. Um, Build on what you have. Don't completely ignore what your roots were, where you started maybe from a professional, like academic, or I mean, as a professional standpoint, and build on it. And so that's what I would say.
Well, it's been fantastic learning more about your background, and I know that a lot of the advice and thoughts that you shared are going to be great for the community. Dr. Paulus, it was great meeting you and learning more. Really appreciate you joining us.
Thank you so much, Brad. I really appreciate being on your show, and I hope that if I'm able to help even one person kind of rethink how what they've been thinking about their life. They've been kind of just down in the dumps and not sure exactly if it's of any use for them to be around. And I really would urge them to say, listen, we love you, and the world loves you, and you need to be here, and let's work on how to bring those gifts out that God gave you. And to be able to be used in for other people.
Great point. Really appreciate that. I know everyone will. To everyone watching, I look forward to seeing you in our next episode. Thank you again.